I'm going to be talking about our experiences within an evidence-based health campaign looking at colic in horses. And what I'm going to focus on today is the things that we've learned in the campaign, the things that we think have worked well, and also some of the things where I think we could improve, and share some of the information we've got evaluating the campaign so far. So campaigns are all over the place at the moment. So hand washing is obviously the one that everybody's talking about. So they're very common in human medicine, and they're starting to be used in veterinary medicine. But we don't want to do a campaign just for the sake of doing it. We need to make sure that what we do actually makes a difference. And that's about how we plan it. And right from the very beginning, you want to think about how you're going to plan and how you're going to involve people. And I'm very much one of these people on the right. If somebody tells me what to do, my back goes up, and I'm probably not going to do what they're going to tell me to do. So I completely empathise with these people. And what's really important is you involve all the people that you are targeting your campaign at every stage. They have to tell you what the problem is, they have to tell you what the potential barriers are to them to being able to change, and they have to help you create the solution. And if you don't do that, then there is a likelihood that your campaign is not going to work. And in terms of equine welfare, there's actually a large number of people who are involved, and probably one of the key people are the horse owners, and that also involves people who are loaning, sharing, caring for horses, the yard owners, the vets, but also all of the people in the different industries, professional organisations, insurance companies, welfare charities. So there's a huge number of people who are invested that we want to get on board with the things that we do. So why involve others? Well, if I sat in the university and told people what to do, there's absolutely no doubt that I would get it wrong. I have lost a horse to colic, but I'm also a colic surgeon, and my perspective is quite different to what some of the other horse owners are. So we need to have people asking whether the problem is important and relevant to them, and therefore are they going to be behind this? Can they trust the information provided? So in our campaign, it would have been so much easier if I had accepted some of the commercial offers, but we knew that we couldn't do that, and we had to make the campaign independent, because to me, anything with a commercial sponsorship potentially affects how I view that information. Zach talked about it. Any changes we ask people to do have to be easy and practical to do. We need to think about what people are personally going to have to do, and then the bottom line is actually if they do all these things we're asking them to do, does it actually make any difference? And all of these are the steps we need to think about when we're planning or asking people to change. I could talk for a very long time about the campaign that we've done. I'm not going to. All of our resources are available for free. Everything that we've published so far is also freely open access. So actually what I'm going to focus on is the steps that we've done, the things that I want to kind of share about what we've done involving stakeholders, and then also how the campaign's going, what's working, and what we need to tweak a little bit. We've actually had 3 PhD students work on developing the underlying evidence. There was lots of information missing that we needed to create. So if we start it up in the top here, Adele Bowden was a PhD student who's now a member of staff with us, and she looked at the owner perspective. So she asked yard owners what they thought was the most important and concerning condition, and that came up with colic and helped drive the focus of that. She also did surveys with horse owners who'd had colic and asked them about the signs of colic that their horses had seen, how they monitored their horses, and also how they recognised different types of colic. So we got their perspectives of where they were happy recognising things and where there were potential problems. Layla Curtis focused on the vet perspective. She did a systematic review which identified that management change was the most important risk factor, and that's one of the messages within our campaign. And we also had to generate new evidence because we didn't really have enough information about colic in the general horse population. Most of it came from referral hospitals. So Layla worked with vets, and so the vets were a really important part of generating the evidence. She got data from 1,016 horses. Adele got data from 923 horses, and that helped us describe the types of colic we're seeing in the general horse population, but also led us to create a list of the red flag indicators, the very early signs of critical cases, which was hugely helpful in terms of what we did. And then the most scary thing I've done in the campaign is we took all the evidence, we gave it to a group of stakeholders, and we said, here you go, it's all yours, what should we do with it? And those workshops were really quite scary, but brilliant in terms of the way that people engaged. And I've just picked out a couple of things that I wasn't expecting and changed what we did. So the horse owners talked about the really early signs of colic. So they said they don't often see the textbook signs of rolling, flank watching, and pawing. They do see them, but often not early. The earliest signs they were seeing were reduced appetite or reduced droppings. And that then became one of the key features of our REACT logo, looking at those early signs to pick up cases as early as possible. Horse owners wanted to know how to identify critical cases from non-critical cases, the really sick ones that were going to require surgery or die. The vet said, that's our job. We don't want non-qualified people doing that. And if you start telling non-qualified people how to identify critical cases, they're going to miss them. And I got quite a strong message that they would not support the campaign. And instead, what we did is our identification of critical cases, we focused on the vets, but on the horse owners, we focused on giving the information about the different options and helping them make the decisions. And I completely agree with the vets, because some of the critical cases can be really difficult to identify. They don't all follow the same things. So again, these two, I just picked them out. We had loads and loads of information, but these were things that changed what we thought was going to happen, and that stakeholder feedback was really important. We then asked people how they wanted the resources, and they said they wanted lots of different resources. They wanted paper copies, posters, videos, social media, so we had to do all of those because we were listening to what people said. And we also asked owners a number of times about their most trusted source of information. And over again, they said it was their local vet. That was the person that they trusted the most and became the most reliable. And I'll talk at the end about our Vet Champions scheme that we're running at the moment, but that really came out of that piece of work. So it's just to give you a perspective of the different ways that the stakeholders are really important, how the owners and vets gave us the information and the data and then shaped what we did with it throughout the campaign. Just some key facts. Like I said, I'm not going to talk about it. If you Google search REACT colic, then hopefully everything will pop up and you can have a look at the information. So the underlying research evidence was developed based on funding from the University of Nottingham World Horse Welfare, and the campaign itself was developed by the University of Nottingham and the British Horse Society. Emmeline Hannelly was one of the people who came along to our workshops, our stakeholder workshops, which then led to our collaboration in terms of developing the campaign. So another good example of how the stakeholder worked well. So we launched it in 2016, and these are just some of the current kind of data around. So this was actually from last week, how many hard copies we've produced. The videos was a little while ago. And last year, we ran the first ever Colic Awareness Week, which had fantastic engagement, over 600,000 social media engagements. And we're running that again the first week in April with an emphasis on critical decision making this year. So what we've been doing is looking at actually whether it makes any difference. And I'll present you some figures at the end about how long you should actually expect stuff to filter down through. So Katie Lightfoot is our current PhD student who's here at the front, and she's been looking at the campaign awareness and also how we develop that as well. So a year after we'd launched it, about a third of people were aware of the REACT campaign, and most people had heard of it through social media. The surveys were run with the help of the British Horse Society, so the actual awareness within the main population is likely to be lower than that. But awareness doesn't mean behaviour change. People have heard of it, but that didn't actually mean they'd changed anything, and there was only a very small number of people who'd actually changed things, which is why we then went on to the behaviour study. So we did a survey that had two components. So this is Katie's survey, trans-theoretical model. And you can see that people group into different areas. They're either already doing things, so most people were already doing an annual dental exam, and most people were not monitoring their horse's temperature, very relevant for the Strangles discussion and Richard's thing at the moment, but they're not ready to do this, and therefore how we're going to target those people, the messages need to be very different. Dave, in a minute, has got the challenge of this group, which is just nobody really knows what they're doing. And then we also looked at what was associated with what people were doing. So this is a theory of planned behaviour, and this is part of the same survey. And if people acknowledged that were welfare benefits, then they were more likely to involve and talk to others about developing their plans. If they believed the plans were worth creating, they were more likely to have done preventative recommendations and also done personal preparation. If they were aware of REACT, they're more likely to have done the preventative recommendations. And this bottom one is interesting. If they felt that there was pressure that they had to implement things, then they were less likely to do preventative recommendations. So it is this balance between informing people, letting them make decisions, and telling them that's what they have to do. Can we just have the Slido slide up, please? So the thing I want you to vote on, there was a recent article in Horse and Hound, I don't know how many people saw it, about a legal case about a livery yard owner where the horse with colic was euthanized and the owner's wishes were for the horse to have surgery, but the owner and the vet weren't aware of it. So I want to ask you whether you think it should be compulsory for owners on a livery yard to share their emergency and financial plans. Doesn't mean you tell them how much money you've got, it just means you tell them how much money you would like to be spent on that particular horse. Okay, can we close that? Thank you very much. So this is one of the things that we're going to be looking at actually this year in the Colic Awareness Week. And then we also did what we called a myth-busting survey. We looked at the impact of knowledge. We asked people a few sort of general questions. We then gave them some facts and information around those questions, and then we looked at whether that actually changed what they did. And so just to give you an example of that, we asked them how often they monitored their horse's heart rate. So 2/3 of it would only do it if their horse was unwell. We then gave them a fact about normal heart rate and the times that might change. And then we asked whether they knew it and whether that would change what they did. So you can see 1/3 of people didn't know it, and of that, 50% would change what they do. And this survey helps you identify, okay, if we give people the information about that, then they're more likely to change what they do. There was also free text responses, and I am very aware that knowledge doesn't necessarily change behaviour. And the free text, we asked people to tell us what they thought and why they wouldn't change, and we had a number of things that came up. So social pressures, influences from other people, things that people, the way they've always done it, and also practicalities, so whether people can actually do some of these things. And then this last one was quite interesting. There were people who were so concerned about their horse's welfare, they felt if they're monitoring the heart rate every day, they would become paranoid about it. So we actually have to take all of those things into account and give those people guidance on why the heart rate may go up and that their horse is not going to die as a result of it. Because if they read some of our papers, we actually say increasing heart rate is a critical case and things like that. So it's just around understanding all the different perspectives and trying to help with those. And finally, I'm going to talk about a scheme that we're running at the moment. So I said the vet was the most trusted and reliable source of information. So we went to vet practices and asked them whether they would help us in terms of disseminating the campaign. And this was great because I used to travel around the country doing talks, and I now have 70 vet practices doing this for me instead. So I actually get my evenings back, which is really helpful. The practices that signed up are committed to promoting our message. We provide them with all of the React horse owner packs. We give them free pens. That's a really essential part of behaviour change. We give them presentations, we give them template newsletters, and also get social media posts. And you can see some of the practices have been absolutely fantastic in terms of engaging this. They've taken it like it is their own campaign and just run with it, which has been really, really good. What we've asked them to do is do surveys, both of their practice policies and what they're doing within their practices, and also their clients as well. And we also have, I'm talking about owners, but we also have some resources for vets as well, hosted by Behaviour on their website. So this is still quite early data because we launched a champion scheme a year ago, so I literally analysed this data last week. And this is looking at what's changed within the 12 months of the champion scheme. So within the horse surveys, 50%, or roughly 50%, had heard of the React campaign, just under 40% had read some of the resources, and just under 20% had used or implemented the information. So you get attrition at every level, and I would love it to be 100%, but this has improved significantly from what we've done beforehand, and that's because the information is coming from their vets. Their vets are behind this, they believe this, and they back it, and that changes what people do. And again, very small numbers, but the people who had read the React stuff are more likely to have shared their plans, got financial plans, and thought about their decision-making as well. So they were more likely to have prepared themselves as well. Feedback, it's identified some of the barriers and some of the issues, but there's also some nice things as well. So when I've had a bad day, and I see how many people haven't heard of React, despite that's the only thing I ever talk about, I read things like this that says that it saved their horse's life. I know it probably didn't, but it makes me feel really good. So there are some really nice positive things, but we've still got some barriers, and I'm aware of these. We had a couple who came to our workshop that said they'd never bought another horse because of their horse dying of colic. It affected them so badly. But they are also one of our best promoters on social media. They've followed the campaign and been brilliant as well. So there's a whole range of reasons, including the raw emotional impact some of these things have on you. So what's worked well? The co-production methodology involving their vets and owners has been brilliant. We've got a really good team of people that follow us and support us. The collaboration with the partner organisations, World Horse Welfare and British Society, this is not an overnight job. These people have to be with you for a long journey, and we've managed to keep those relationships going and have that long-term relationship, and that is so important. This is not a one-year campaign or a 2 or 3 year. You've got to have people that are with you for the long term. And the champion scheme, we hoped for 30 vet practices. We've got over 70. We're relaunching it this year. That's worked really well. What we could have improved? Well, owners told us all the things they wanted to do, and me being me, tried to do everything. If I'd done one message, like hand washing or something like that, it would be much easier to do that and to measure it and things like that. So we could definitely have made life easier. Katie came on board and started the behaviour change work. If I went back and did it again, I'd do it at the beginning, so we knew a little bit more how we were shaping it. Ideally, we know some of the evidence is messy, and ideally we'd have a long cohort study that went over years, but we just can't do that. And then the last one, that's a personal note for me, I need to be more patient. In the medical profession, it says it takes 15 years to implement change. So I'm hopping up and down after 6 months saying, why isn't everybody doing this? So I know that I will probably be dead by the time everything actually gets changed. But I just need to wait a little bit longer and be aware that everything happens. And then finally, there's been a huge number of people who've helped me. So our PhD students, Layla, Adele, and Katie are the main ones that I want to highlight. And I managed to persuade some undergraduate students every year to come and be my student slaves. And I'm very indebted to them for all the work that they do. Thank you very much.